So today we'll talk about amylase and lipase. So amylase and lipase are pancreatic enzymes. And for this discussion, we'll discuss the sources, the diagnostic significance, the different laboratory procedures or techniques or assays in order to determine the concentration of amylase and lipase. So regarding amylase, or we'll start with amylase. So amylase is an enzyme belonging to the class of hydrolases. So when you say hydrolases, these are the enzymes that facilitate the breakdown of a substance or to split, okay, or to degrade. If Now, what are the tissue sources of amylase? So we have the major and the minor sources. So for the major sources, we have the pancreas and salivary gland. And when say salivary gland, there are three kinds of salivary gland. You have the parotid gland, the submandibular gland, and the sublingual. Okay, so if there's inflammation, okay, in any of the three salivary gland, it's automatic that there's increase in amylase. Okay. Next, when you say next is the minor sources. So for the minor sources, we have skeletal muscle, small intestine, fallopian tube. And remember that amylase is the smallest enzyme in terms of size. Okay, that's why it's readily filtered by the glomerulus and it appears in the urine because it is a small protein or a small enzyme. Okay, so next is what are the diagnostic significance of amylase measurement? So first is to uh, uh, diagnose acute pancreatitis. Okay, uh, because it's a pancreatic enzyme. So it's the first marker to increase if there's pancreatitis. Okay, but regarding amylase, elevated amylase level is non-specific finding. Okay, because there are a lot of sources of amylase. So to increase the specificity of amylase measurement, we need to add more tests or we need to perform other tests in order to support, okay, the findings about AMS level. Okay, so we need to measure urine amylase. Okay, because when we can measure urine amylase, why man nga maka-measure tag urine amylase? It's because amylase is a small enzyme. So it appears in the urine. Okay, so measurement of urine amylase. Next, to determine amylase clearance or to perform amylase clearance studies. And third, measurement of isoenzyme, because if we're going to measure the isoenzyme, it's more specific compared to the concentration of total amylase. And another is to perform lipase measurement. Why? Because lipase is used to differentiate the increase in amylase. Uh, if there is inflammation in the salivary gland, automatic there's increased in amylase, but lipase is not elevated. in cases of salivary gland involvement. But if we're talking about pancreatitis, both amylase and lipase concentrations are elevated. Okay, so remember, in clinical chem, we usually perform panel testing or a panel test. So, uh, panel is composed of different tests, okay, in order to rule out, okay, or to be specific with the diagnosis. So, example, if there's increase in amylase, or it's better to perform a panel test in order for us to diagnose pancreatitis, okay, or for amylase concentration to have a value in the diagnosis. Now, regarding serum amylase, it begins to rise 2 to 12 hours after the onset of the disease, okay? And the peak concentration of amylase, it's 24 hours after the onset of the disease. And it will return to normal within 3 to 5 days, okay? There's no further injury to the site or the infected site, okay, or injured site. Now, other diseases with elevated amylase, you have salivary gland lesions. For example, if there is mumps and parotitis, okay, so mumps, it is caused by mumps virus, and that mumps virus is the reason why there's inflammation in the salivary gland. Okay. Another, you have intra-abdominal diseases. So amylase is also increased if there is peptic ulcer. Another is intestinal obstruction. Okay. Ruptured ectopic pregnancy. Okay. So for ectopic pregnancy, di ba dapat ma-develop ang bata sa uterus? But for ectopic pregnancy, na-develop siya sa fallopian tube. Okay. Then next is appendicitis. So if there's appendicitis, amylase is also elevated. So these are the diseases correlated or associated with increase in amylase. Okay, so next is what is macroamylasemia. So macro meaning big. Okay. So, amylase molecule combines with immunoglobulins to form a complex that is too large to be filtered across the glomerulus. So, for a macroamylasemia, so remember, when you say amylase, it is a small enzyme. Okay? Small enzyme. But for macroamylasemia, there is a combination or complex formation between amylase and immunoglobulin. Okay? And remember, immunoglobulin is a big protein. Okay? So, after that complex formation between amylase and immunoglobulin, that complex is not readily filtered by the glomerulus. Okay? Um, you cannot eliminate that one through urine. Okay? So, there's increase in serum amylase level. Okay? Because of the decrease in the normal renal clearance of the amylase enzyme. Reason, because the amylase enzyme made a complex with immunoglobulin. So it's a combination of amylase and immunoglobulin. And that's too big to be filtered out by the glomerulus. Okay. Now, for macroamylasemia, so there's increase in serum amylase, but the amylase concentration in urine is low. Okay, it's because of the decrease in clearance. Why there's a decrease in clearance? It's because macroamylase is a big amylase enzyme. Okay, so it's difficult for the body to eliminate macroamylase. So there's increased amylase in serum, but there's a decrease in amylase concentration in urine. Okay. Okay, so regarding isoenzymes of amylase, you have the P-type and the S-type. So for P-type, it is derived from the pancreatic tissue, and for S-type, it is derived from salivary gland tissue, fallopian tube, lungs, and other minor sources of amylase. So P-type and S-type. P-type for pancreatic, meaning pancreatic type. S-type, salivary gland type. Okay. So isoenzymes of salivary origin. So in instances or conditions or presence of acute pancreatitis, there is elevation in the P-type activity, meaning the P-type isoenzyme of amylase. Okay, because P-type, it is derived from the pancreas. Okay, so it's normal or it is expected that if there's pancreatitis, the P-type level is elevated. And among the three um, pancreatic isoenzymes of amylase, it's the P3 that is predominant in cases of pancreatitis. Okay. S-type represent approximately two-thirds of amylase activity of or in a normal serum. Okay. P-type predominates usually in normal urine. Okay. And amylase isoenzyme analysis is not readily adaptable as a routine laboratory procedure because the procedure for isoenzyme measurement it takes too long. Uh, it requires a lot of time, okay, because you need to separate the different isoenzymes of uh, amylase. So it's not a routine test, okay, in the clinical laboratory. Okay, so next is we'll talk about the different assays or methods in the determination of amylase activity. So first is amyloclastic method. So for amyloclastic method, amylase is allowed to act on a starch substrate to which iodine has been attached. As amylase hydrolyzes the starch molecule into smaller units, the iodine is released and a decrease in the initial dark blue color intensity of the starch-iodine complex occurs. The decrease in color is proportional to the AMS concentration. Okay, now for amyloclastic method, the substrate that we're going to use is starch that is complex to iodine. Okay, now the color of this complex between starch and iodine, it is dark blue. Okay, so remember it's dark blue. So this complex is present in the reagent. Now we need to mix the reagent with the specimen or serum. And the serum contains amylase. Okay? Amylase. Okay, amylase na lang, A na lang. Okay? So this amylase will try to hydrolyze this complex. Okay? Or will hydrolyze this complex. Okay? So split up niya ang complex between starch and iodine. So the result, there's a decrease in the intensity of the color because na-split naman ang starch iodine complex which has a dark blue color. So after that hydrolysis, the intensity sa color will decrease. Okay? Now, that decrease in color intensity is proportional to the AMS concentration. Okay? So, if grabe ang pag-decrease sa color intensity, meaning there's increase in amylase concentration, meaning there's a lot of amylase able to hydrolyze the starch-iodine complex. Okay, so that is for amyloclastic method. The next method is Saccharogenic method. Okay, so it uses starch as substrate that is hydrolyzed by the action of amylase to its constituent carbohydrate molecules that have reducing properties. So for Saccharogenic method, we're going to measure the amount of reducing sugars produced from the activity of amylase, or reducing sugars converted from the starch being used as substrate. Okay, so the same with amyloclastic method. For Saccharogenic method, we're using starch, but it is not complex to an iodine. For this one, it's plainly starch lang, okay, as the substrate. Now, because of the presence of amylase or activity of amylase, the starch will be converted to different uh, sugars. Okay, so example, or when you say sugars, there are reducing and non-reducing sugars. So for Saccharogenic method, we're measuring the amount of reducing sugars produced from starch. Okay. Now, regarding Saccharogenic method, um, it is the classic reference method, and it is reported in Somogyi units. Okay, so for Saccharogenic method, we're not using U per L or IU per L as unit. For this one, we're using Somogyi unit. So it is the milligrams of glucose released in 30 minutes. Okay, or within 30 minutes, the amount of glucose or milligrams of glucose produced in 30 minutes. Okay, that's for Somogyi unit. So uh, for Saccharogenic method, we're measuring the amount of glucose produced from starch. Okay, so we're converted from starch. So conversion of starch to glucose. Okay, so glucose is a monosaccharide. Starch is a complex carbohydrate. So the function of amylase is to convert a complex carb to a monosaccharide. Okay, so that's for Saccharogenic method. We're measuring the amount of reducing sugar. Okay, so the third method is the chromogenic method. So for this one, the same with Saccharogenic and amyloclastic, it uses starch as substrate. Okay, but for this one, the starch is complex with a dye. Okay, so there's a chromogenic dye attached to the substrate, which is the starch. Okay, so as AMS hydrolyzes the starch substrate, smaller dye substrate fragments are produced, and these are water soluble. So for this one, the substrate is combined with a chromogenic dye. But once this substrate is hydrolyzed, it will produce smaller fragments of uh, the dye, which is uh, water soluble. And since it's water soluble, it will give color. Okay, so if there's increased breakdown of the substrate, there's also increase in the color intensity of the solution. Okay, so for chromogenic method, the intensity of the color is directly, or the intensity of the color is directly proportional to the concentration or to the AMS activity. Meaning, if it is mas intense ang color, meaning the concentration of amylase is also increase. Okay, so that's the correlation, okay, of AMS activity in chromogenic method. The fourth method is continuous monitoring. So for continuous monitoring, meaning you need to make uh, or to perform absorbance reading multiple times. Okay, so meaning you have first reading and second reading, and you get the difference of that one. Okay, and That's the basis for the activity of amylase. That's for continuous monitoring. Okay? It's not one time lang ang pag-read sa absorbance, but multiple times. Okay? That's for continuous monitoring technique. Okay, so regarding sources of error in the determination of amylase activity, first, AMS in serum and urine is quite stable. There's a little loss of activity uh, at room temperature for 1 week or 4 degrees Celsius for 2 months. Now, regarding inhibitors of amylase activity, triglyceride inhibits amylase activity. So, meaning if the sample is lipemic, then it is expected that the amylase level is decreased. Okay. Next, regarding morphine and other opiates, it falsely elevated serum amylase level because it causes constriction of the Oddi sphincter and pancreatic duct. Okay, so that's the effect of morphine to amylase activity. It's increased. Okay, so next is reference range for serum. Um, for Saccharogenic method, it's 60 to 180 Somogyi unit per DL. And for other methods, it's 95 to 290 U per L. And for urine, it's 35 to 400 units per hour. Okay, so that is those are the reference ranges for amylase activity. Next, we'll talk about lipase. So lipase is the more specific pancreatic marker compared to amylase because amylase is present in other tissues. Okay, but the first marker to increase in pancreatitis it's amylase. More specific one, it's lipase. So for lipase, lipase hydrolyzes the ester linkages of fats to produce alcohols and fatty acids. So for lipase, it has a different function. Uh, a young function is to hydrolyze fats or lipids. Amylase is for the breakdown or hydrolysis of carbohydrates. Okay. Now, regarding tissue sources, lipase concentration is found primarily in the pancreas, although it is present, although it is also present in the stomach and small intestine. But the primary source of lipase it is the pancreas. Okay, so regarding diagnostic significance of amylase, it's for the diagnosis of acute pancreatitis. It's more specific for pancreatic disorders than amylase. And elevated lipase levels also may be found in other intra-abdominal conditions, but with less frequency than elevations of serum amylase. Okay. LPS levels are normal in conditions of salivary gland involvement. So regarding lipase, it is also increased, or there's a possibility of lipase to increase in other intra-abdominal conditions, but it is less frequent compared to amylase. Okay? So that's why it's more specific, pancreatic specific ang lipase. Okay? And regarding LPS uh, increase, uh, it is normal in salivary gland involvement. So meaning if the patient has mumps, the lipase level is normal. Okay, only the amylase concentration is increased. Okay, that's for lipase. Okay, so it's not increase in conditions where uh, there is salivary gland involvement. Next, regarding assay, so usually it is based on the estimation of liberated fatty acids and Turbidimetric method. So the first method for the measurement of lipase, you have the Cherry-Crandall method. So for Cherry-Crandall method, it uses olive oil as substrate, and you need to measure the amount of fatty acid liberated from the substrate by titration. okay, after 24 hours of incubation. So you need to incubate the serum plus olive oil for 24 hours, and after that, you measure the amount of fatty acid using titration. Okay? Because, di ba, if we talk about lipase, the function of lipase is to hydrolyze um, lipids. So meaning there is liberation of fatty acids. Okay? Another, regarding Cherry-Crandall method, you can also use triolin. Okay, so this is the new substrate for Cherry-Crandall method instead of using olive oil. Okay, so that's for Cherry-Crandall method. Next method, you have the Turbidimetric method. It's simpler and more rapid. Fats in solution create a cloudy emulsion. As the fats are hydrolyzed by LPS, the particles dispense and the rate of clearing can be measured as an estimation of LPS activity. So for turbidimetric method, uh, you need to have a solution uh, that contains fat, and may say fat na solution, usually it's turbid or cloudy. Just like your lipemic sample, diba? Lipemic sample is cloudy. Okay? So for turbidimetric method, you're going to measure, okay, the rate of clearing, okay, of that turbid or cloudy solution. And the rate of clearing, okay, it's an estimation of the LPS activity, okay? Because on lipase, it will likely clear a turbid solution that contains fat, okay? Because function of lipase is to break down fat, okay? Okay, so regarding sources of error, hemolysis should be avoided because hemoglobin inhibits the activity of serum lipase. Okay, so you should not use hemolyzed specimen for lipase determination because it will yield false decrease in lipase activity. Lipase is very stable in serum with negligible loss in activity at room temperature for 1 to 3 weeks at 4 degrees Celsius. Reference range of lipase is 0 to 1.0 units per liter. Okay, so remember, amylase is the first marker to increase if there is pancreatitis, but the specific one is lipase. Okay? And if there is salivary gland inflammation, only amylase is increased. Lipase is normal. Okay? So I think that's all for amylase and lipase. Thank you and God bless.